Good afternoon, comrades and my friends and relatives and the people that I associate with. Welcome back to Public Health Unmuted, a podcast where we pull back the curtain of social injustices and health disparities affecting communities of color, veterans, and older adults alike. My name is Archie Robinson, your host, and I'm representing from the DFW here in the Lone Star State. Today we have a truly compelling conversation lined up with my guest and my attorney brother, Mr. James Frison, who was a former community liaison to corporate giants at the bridge between business and community. Ultimately, chose to dedicate his life to nonprofit leadership and youth development. But this isn't just a career story; it's a story about health, wellness, unity, and what it costs to chase success in spaces that aren't always designed with our well-being in mind. So let's get in. James, welcome to Public Health Unmuted.
Thank you, brother. I appreciate it. Thanks for having me.
And so it was good, man. I know me and you've known each other for a long time, and I see you've been doing a lot of big things. So I wanted to take the time to highlight you and give you your flowers and let the people know what Mr. James Frison is about. And if they want to reach out to get some type of consultation or some type of mentorship, even though for a small fee, I'm sure you can help them out.
You got it.
So, so let's start at the beginning. So you've had an impressive career as a community liaison for major corporations. Can you walk us through what drew you to community focused roles and within the corporate world, and what ultimately inspired you to transition to nonprofit leadership?
Yeah, no, I can tell you this was a total accident, if you will, because I had no intentions, no desire or interest to work in a community facing role or work in a nonprofit for that matter. So I was working um, at a fairly large company doing more sales, marketing, merchandising, and the opportunity just came out of nowhere. Actually, I had actually switched to supplier diversity, and then the opportunity came to move into more of a community relations role, managing um, our philanthropic efforts worldwide. And honestly, when opportunity came up, I was disappointed when they first told me because it just wasn't on my radar screen. This is completely left field from what I thought I was going to be doing in my career. But I said, you know what? Let me give it a shot. Let me at least get in a role, see what it's about. And when I started learning like what I'd be responsible for, then I was like, you know what? This is perfect for me. Like this is what I need to be doing. This is what I was born to do. And so I really got into the role. Was really excited about leveraging corporate resources to make an impact in the community in partnership with nonprofits. And I did that work for about 3 years for that particular company and then transitioned to a different company, a larger company, and was in a similar role where I ran the foundation and community relations efforts and did that for a few more years. So through that experience, I actually interacted with a number of nonprofits and thought about it like, I've been doing this now in this corporate side for 30 plus years. If there's an opportunity, maybe I can transition over to the nonprofit side one day. And that opportunity came up and I jumped on it just over a year ago and haven't looked back. So that's what got me from where I was to where I am now.
So it's more of a not knock it till you try it type of thing because you thought, being that it had to do with community service, which was, already in your veins, that might turn out to be something you like, right?
Yeah, I just didn't know what it was. I mean, you think about community relations. I mean, honestly, at the time, I was like, so what is the challenge in that role? I mean, am I just going to be shaking hands and kissing babies? I mean, what's the big deal about community relations? I didn't know until I got into the role and I understood more about what the objective was and went in. I developed a strategy and then took it from there and took the company to a different place compared to where it was. So I really got into it and I'm passionate about that kind of work.
So what was that experience really truly like for you, not just professionally but personally?
Well, personally, you grow up and you see certain things out in the world, and you get to a point in your career where you want to make a difference and you want to make an impact. And I had an opportunity to do that in my day-to-day job, which was huge. So I wanted to put my best effort in it and make sure that we were getting the highest use out of every dollar that we contributed to the community, that we made the maximum impact possible. So that was my goal the whole time that I was in it, is I want to make an impact and make a difference.
Well, just like with any position, any role, any leadership, or anything like that, there's always an issue with stress management and dealing with unforeseen issues. And, at our age, as we reach our 50s, we tend to deal with stress differently. And from a public health perspective, what were the most significant stressors or health challenges you face, whether physically, mentally, or emotionally, and how did that corporate environment either support or hinder your ability to manage them?
Yeah, for me, like really for most people, it's all about choices and balance and setting boundaries. So working in on the corporate side, and this goes back all the way back to 93 when I first started working, you know, corporate America is very demanding and you end up at times putting in 60, 70 hours a week. Doesn't leave much time for anything else. So I had to make a choice of maintaining my health, making sure that I'm eating well, that I'm getting consistent exercise. And I remember probably the first 10 years or so, I would get off from work and work out in the evening.
Mm,
The problem was I couldn't be consistent because there was stuff that came up at work. We had an after work event, something like that. And then that would impact my ability to go in and work out for myself. So I want to say around 2002, I switched and started working out in the mornings. Now, again, it's about choices and consequences. So yeah, I get up early. I'm working out by 5:30. I'm starting my workout in the morning.
mm,
But the problem is I sacrifice sleep.
right,
So I'm tired in the evening. 8, 9, 10 o'clock. If I'm not moving around doing something, I'm probably not in our sleep. But the good news is there's nothing else happening that early in the morning. So I can be
right,
consistent at least 5 days a week. I can make sure I go in and get my workout. And I always looked at it as I got to put deposits in my health account. Meaning I make
right,
sure I'm contributing to that at least 5 days a week, at least an hour a day with some serious training, just so that I can stay healthy. And as African Americans, we have unique health challenges, heart disease probably being the biggest one. And so I just always felt like, I mean, you're not going to be able to prevent um, poor health from coming, but I at least want to do my part to see what I can do to contribute to having good health. So that's what I did over the years. And it was all about just making choices and setting boundaries. It also meant, though, not just during the week when I'm working, but I committed to whether I'm on vacation, I'm traveling, I always bring workout gear because my intention is to make sure I maintain my workout schedule on vacation, holiday, it doesn't matter. I'm still going to make sure I do it. And I've been doing that now for well over 20 years.
wow. Well, that's great, man. So, did the pressures or rewards that impacted your sense of purpose and well-being? Did it really impact it, or were you able to easily navigate it and maintain your own level of authenticity while representing a corporate brand?
You're talking about in more of the community relations role?
Exactly.
Yeah, I was able to maintain my authenticity and probably more because that came at a later point in my career. So at the point I started taking on those roles, um, I was pretty solid in terms of who I am. So there wasn't going to be much pressure that would change me and how I showed up. So I was able to withstand that in some pretty challenging situations. And again, the main goal it really wasn't about me. It wasn't even about the company. It was about making an impact, knowing that I'm at the company and you got to satisfy what the company's trying to achieve. but also trying to balance that with how can we make a true impact in the community and get a win-win for everybody. And so every single initiative, every single project, every single nonprofit I work with, that was the goal. Make sure we can make an impact.
Oh, so you were able to stay true to their values and a mindset that keeps the contentment in carrying out the directives while also making a little sense.
Yeah, for the most part. I mean, there were times when you might have some chief executives at the company that might have a certain thing in mind that they want to do in the community, and they want to leverage, the community relations or philanthropic department or foundation to do these certain things. But I would always bring people back to these are kind of our bylaws as a foundation, and there are certain things that we have in our principles that we can't do, and that was
Mm,
decided from the very beginning. I'll give you an example. I remember a time there was we had received a letter from, I think it was somebody's parent, and this kid, and it was a tough situation, but they actually had a terminal disease, and their goal, what they wanted, their dream was to go to the Super Bowl
mm,
and wanted to know if the company could cover the cost. um, and I just remember being challenged by, one of the executives around, we got to do this, and I just reminded them that our policy says that we can't and we don't provide assistance to individuals. And the reason for that is where does it stop? So the very next week, it might be some other young
right.
person that's got a terminal disease and they want to take a trip around the world. So there are organizations that fulfill those dreams, like, Make a Wish Foundation, that kind of stuff. But that is not what we do as a foundation. So
Right.
it's a tough position to be in, but you just got to stick to your principles, even in the midst of pressure, and just be confident enough to push back and say, we got to do the right thing. We got to do what's right by the company and also make an impact in the community. But this is not the way to do it.
Mm, yeah, it does. That does make sense because you can't please everybody, and if you do one, then there's an expectation that you do for the other.
Yeah. So our policy was we would provide assistance to organizations, but not to individuals.
Mm,
And there were only certain organizations like, 501(c)(3). We could work it out there, but we stayed away from other things that might just cause issues. So just follow the policy and you should be in good shape.
most definitely, most definitely. So even though this wasn't too far off, but the pandemic had changed a lot of people's ideas about health, coming to work, doing the things that you need to do to stay active and healthy and in shape. So, given what you were doing and in your position then, how did you see the pandemic affect employees' health and wellness in these environments? And what lessons do you think corporate America still needs to learn about supporting worker well-being?
Yeah. So back during the pandemic, it was a difficult time for a lot of people going through it. And I was still in one of those roles back then. Um, and I remember the struggles personally of we didn't really even know what this thing was. I remember I was on a trip, I was in California on a work trip, and we started hearing on the news about this virus thing that was going around that they were calling COVID. And I think, they said it started in China and there was some people getting sick on flights. Still didn't know how big it was going to be. But once we got back home, then it just kind of blew up from there. So when you're sitting there working, people are struggling, asking questions around, how do I manage through it? And I'm sure you remember back then, even buying groceries, you bring your groceries to the house, you sitting there washing them off in the in the garage
Mhm.
before you bring them in.
Right.
All kind of things that we did, wearing masks and washing your hands. We bought more of that hand sanitizer. I remember there was a run on toilet paper.
Mm-hmm.
Run out buying toilet paper, couldn't find it. They
Came
limit
out of
you to
nowhere.
one pack. Right.
Yep.
Yeah, it was all kind of craziness going on. But then I also saw it in the community because when the country shut down and people were out of work, for the most part, it hit our communities the hardest. And you would
Hmm.
see that. So people standing in the food lines looking for food, supplies, and help. You could really, it was amplified in the Black community. Um, so again, being in the role that I was in, the goal was how do we make the greatest impact yet satisfy what the company wants. And so I tried to steer the company to let's make sure that we address the places with the biggest impact.
Wow. Wow. So, looking back on a more personal note, were there moments in your own corporate career where you had to make tough choices between career advancement and protecting your own health wellness? And if so, what advice would you give to professionals, especially people of color and high pressure roles that they're in settings and boundaries that they definitely need to prioritize their own self care?
Yeah, I think that's an issue that we all have to grapple with. And for me, it was around setting boundaries. So there were certain things I was willing to do, probably a longer list of things that I was not willing to do. So when it came to my career, um, I had to make some choices about certain roles that I was asked to take, or people asked me, "Hey, James, I think this would be good for you. We need you over here. We need you over there." And there were a number of times that I said no. And you always have to be selfish and think about what are you getting out of this, which also means you need to have some goals in mind and a roadmap for where you want to go with your career. Because if you don't have a roadmap, don't know where you're going, then any role will work. But
Hmm.
you'll look up after so many years and you're ending up just kind of floating out there because you really didn't have a plan. So there were times that I just said, no, this does not match with what I want to do, with what I want to get out of my career. I get that it might be beneficial for you. And I get that you might see certain skills or experiences I could bring to the table, but that's not going to work for me. And I
Hmm.
think everybody needs to make that choice for themselves and understand that you may be giving up some opportunities and be okay with that. It's okay because at the end of the day, I want to be happy with how I got it, my career. You only get one shot at this. There are no repeats in life. So I'm going to get it right and do it the way I want it to be done.
Right. Well, it seems like when you made the transition from corporate America to the nonprofit leadership role, that you had more leeway to integrate, your thought process, your mindset, and some of the things that you feel not that was not only important to you, but important to the people you serve, as well as those that are in your environment. So, given your current work role in addressing, health disparities and wellness gaps, because this was podcast is definitely about, addressing social injustices and health disparities. Um, what have you learned or observed during your time in corporate America,
For addressing health disparities,
or your, just maintaining your own mental health and self care? Period.
yeah, I would say just kind of going back to the boundaries discussion, that protecting your own mental health, you got to get to a point where you leave, sorry, that you leave work at work
Mm-hmm.
and you don't bring that stuff home.
Mm-hmm.
And there are certain ways to do that. Like you just got to set some boundaries that, I was talking to somebody the other week around vacation time.
Mm-hmm.
I'm not going to take vacation and be standing in the water at the beach with my laptop. It's not going to work. I got to set boundaries. I'm on vacation. I'm on vacation.
Exactly.
Now you can call me, but it needs to be an emergency.
Right.
Otherwise, it can wait till I get back. The other thing, I mean, Lisa and I used to, we travel a lot internationally, and a bunch of those trips were 2 and 3 weeks.
Right.
And I've always said, there's my golden rule when it comes to vacation. if you aren't gone long enough to where you have to write down your password, to me, that's not a vacation.
Right.
So if you're
Right.
gone for a few days, you come back and you can log right in, you weren't real on a vacation. That was more like a weekend break.
Right.
So I always thought about that. Like, when we're gonna take a vacation, we need to be gone long enough that I need to write some stuff down because I might forget by the time I get back. Again, it goes back to setting boundaries
Hmm.
for my own mental health. The other thing, got a friend of ours who worked a lot and had a large bank of vacation. And we had a discussion
Hmm.
about that. What are you saving it for?
Exactly.
Yeah, take your vacation, invest in experiences versus things, because those are the things that will sustain you during the rough times. You can remember back to your trip to Italy or wherever you went. Those are the things that will sustain you. So we set boundaries pretty early on, and I've stuck to that through my whole career.
Hmm. Man, that's good. A lot of people really don't know how to separate work from leisure. And there was a time when we were on vacation, and my wife had got the call from her boss, and I'm like, man, we out here, drinking mai tais out here by the poolside. What in the world could be so important? You knew we were leaving the country,
Yeah, we're
but
drinking Mai Tais. It's Mai Tais, not your tie. See, they wanted to be them. They want you to be at their disposal 24/7. I don't care if you're on vacation or not. I need you to respond to this email. No, I'm drinking a Mai Tai. I'm on the beach. Like, I'll
right,
see you when I get back.
right,
And as
right,
long as you plan for it, prep your team for it, make sure that people understand, you know, take care of anything that's hot before you leave so that there's really nothing big happening while you're out. That gives you a little bit more leeway to do that kind of stuff as long as you're responsible. So, you
right,
don't want to take a vacation and leave a whole bunch of stuff for somebody else to execute while you're out. So just
exactly.
plan ahead and then you can enjoy your vacation.
Most definitely, man. I tell you, brother, it was good talking to you. I'm glad that you're able to come out and make time for the pre-Thanksgiving shenanigans or whatever it may be. So before we wrap up, is there anything that you'd like to share with this audience as it relates to those who are probably at a crossroads in their career right now, not so sure they want to stay in corporate America or might be thinking about transitioning over to a nonprofit leadership role? Is there anything you would share with them that will also reiterate the importance of balance between their ambition and their purpose and their overall well-being?
Yeah, there's a tool, I think it's called Ikigai, Ikigai, and it asks some key questions. So, what do you what do you love to do? What are you good at? What can make an impact in the world? And it's the once you answer those questions, it's that thing that's in the middle, um, that crosses all three of those areas. That's usually your sweet spot. And I advise people to use that as a guiding principle. So if you're working in accounting and you're like, man, it's the most boring job in the world, go back and start asking yourself, what do you like to do? What do you love? What would you do if you could do it and do it for free? What would that thing be?
Oh
And
yeah.
then ask yourself, what is the impact that it has in the world that you could get paid for? And then do you have the skills that allows you to do that thing? That's probably your sweet spot. And I would use that as kind of my guiding light for where I'm going to go. And then you line up your career that gets you to that goal. So there are going to be certain roles that you say, no, that's not on my map. I know it sounds good, appreciate the opportunity, but I'm going a different direction. And that gives you the confidence to do it. The other thing I'll say is just make sure that you are managing your personal finances,
Hmm.
that you are minimizing debt and bills, that you've got some savings and some investments, because then it makes these kind of bumps in the road easier to navigate when you've got some financial freedom at home.
Right.
So I would advise that. That helps you be a lot more selective about opportunities that you might take or you decide to say no.
Okay. Most definitely, because I've always heard people say that when they're looking for their divine purposes or their ambition driven purposes, the question is it something that I love so much that I would do for free? And typically, if that answer is yes, more than likely, when those hardships come around, those challenges, or the days when you don't feel like getting up and being bothered with it, you're already motivated to do it. You wake up every day looking forward to do it because it's something that you really enjoy doing. And, that's like, I love pushing, my wife because even though she's a federal employee, she has a public relations bill, her business, a public relations business, and that's something that she really enjoys doing. That's something that she looks for every day when she opens her eyes to get into. It's always, oh, I got to do this or I got to get that done. Reach out to this person, that person. I was like, man, you really love it more than your job, don't you? She's like, hell yeah. I'm like, I'm like, that's good. And so I'm always looking forward to um, finding and doing things that I would love so much that I do for free as well. Because after doing 20 plus year in the military or doing anything for 20 plus years, you kind of get caught in that rut, and then you start looking at retirement and looking at other stuff that you may have been interested or stuff that you really wanted to do but never paid much attention to. Then you're like, man, I might have missed my calling. I should
Right.
have done this 20 years ago.
Yeah. And you can't get that time back. And you can't go back in time, period. But she's in that top, I want to say the statistics are, she's in that top 10%. It's only 10% of people, might be less than that, love what they do in the world.
Mm-hmm.
And then there's probably 65% of folks who are just showing up. So their body is there, but their mind is somewhere else. And then that remaining 35% actually hate what they do every day. Definitely want to be in that boat. So if,
Well,
I think the goal is to get to that 10% where you really enjoy, because that takes the stress off. When you show up every day and you love what you do, takes the stress away. You're willing to sacrifice. It's that quote around, some places you can work and a 40-hour week feels like 80. And there are other places that you work where you can put in 80 hours and it feels like you only put in 40 because you love what you do. In cases where you hate what you do, a little bit of time feels like a lot. Like, man, I feel like I done worked 80 hours this week and you only put in 40
yeah.
because it was a hard 40.
Yeah, and then sometimes you do them 80 hours and you realize you may think you didn't do enough, but you
Right.
did 80 hours, but you want to do more.
Yeah. Yeah. So that's kind of the state that you want to be in your everyday life and work.
So let's get back to this 5:30 in the morning thing that you always get that going. And I remember when I was in the military, 3:30, 4 o'clock in the morning was a norm. You get up before the crows or the chickens begin to roost.
Hmm.
And you do more by 9 a.m. than people do all day. And I look back, I said, yeah, we did do a lot of stuff starting at 3:30. But now, at this stage in life, getting up that early in the morning, do you think it's just because we done got old, or it's just something that's inbred in you? It's just subconscious, a natural response.
I think it's harder the older we get to forget about getting up early, but just working out in general. Because your
Mm-hmm.
body gets tired, your mind gets tired. But I always keep in the forefront of my mind is I'm doing this for my health because I would like to live to be 90, 100 years old, still be in my right mind, still be able to get around physically without, help. And so I can't
Mm-hmm.
guarantee that. But what I can at least do is make my daily deposits in my health account. And that's getting up, whether it's cold outside, raining, I'm sleepy. I still got to get up. The alarm goes off, I get out the bed. The other thing I was going to tell you is a long time ago, I decided to make that part of my routine. So just like you get up every day, you take a shower, brush your teeth, I also work out in that same mindset. And then
Mm-hmm.
to make it really stick, I became a body pump instructor about
Mm-hmm.
15 years ago. So now, and back then I taught 2 days a week. Now I only teach 1 day a week. But either way, I always knew that somebody was waiting on me at 5 or 5:30 in the morning. I got 15, 20 people waiting on me to show up to teach. So I don't
Right.
have a choice but to get up. Not only do I only have a choice to get up, but I also have to maintain a certain level of fitness in order to do the job.
Right.
So that makes the other days matter too. And I've been doing that now for at least 15 years. So
Mm.
my advice would just be to make it routine. Just something that you are automatically going to do, just like getting up, taking a shower. I'm going to go work out.
So it's just you just plan on doing it till you just can't do it no more.
Or I'll switch. So at some point, I'm probably not going to be able to do body pump the way I'm doing it now. So I'll switch to something else, whether it's yoga or whatever. I'll switch, but I'm still going to maintain exercise on a consistent basis, no matter what.
Hmm. Because I know we talked about Tai Chi at 50 plus nowadays, and that's a big thing. But believe it or not, it's very effective.
Yes.
You know, it may look easy during the process, but at the end of that workout, you definitely feel like you did something.
Oh yeah. People say the same thing about yoga. Like, man, that stuff is that's lightweight. Okay, get in there and try it. Go in there at 250 pounds and try it and see what happens about the first 10 minutes.
Yeah, yeah, yeah. Like to show you better than tell you.
A lot of people say that about body pump. So typically I have a class that's majority women, and you see the guys in the gym, they walk past the window, and because we do lightweight, but we do a lot of reps. And it's a full hour
Hmm.
class. We work all the major body parts, and people assume that it is easy. Well, I actually had a neighbor of mine when I taught in Charlotte who came to my class, came to the front of the class, one of maybe three guys in the class. And so I took my mic off, and before the class started, I say, "Hey, you might want to drop that weight down, man. I mean, for real. Like this ain't like what you do out here in the other part of the gym. Like you just want to drop it down." He was like, "Nah, I got it. I got it, James." Okay. Hey, I'm just sharing a little advice. And about halfway to the class, he ran out of the class. And when I saw him later, it wasn't even later that day. I think it was the next day. He told me that he actually threw up, and he was too embarrassed to drop the weight. Mainly because a lot of women in the class. And I told him, I said, that's what happens. People assume that it's easy. I can bench press 350 pounds. I come in your body pump class, and man, this is nothing. Okay, come on in here. We will see.
I tell you, a lot of these men as they get older need to stop leading their ego and let them young days go because
Yeah,
that pain and that long recovery process will definitely make a believer out of you.
right. Yeah. So it forces you, age will force you to make some different decisions.
Wow, man. Brother, I appreciate you for joining me today on Public Health Unmuted. Your story is definitely a reminder that our health and our purpose are deeply connected, and that that sometimes the bravest thing we can do is choose ourselves in our communities over that corner office. Is there anything else you want to share, or is there a way that people can connect with you if they want to follow up with you further?
Oh yeah. If folks want to reach out, feel free to find me on LinkedIn. For those that don't know, it's a career platform that's been around for a while. So that's probably the easiest way to reach out. And then the only thing I'll say is just a reminder of have a plan for your life, have some goals in mind, set boundaries, and be willing to make decisions knowing that there may be some cost or some opportunities that you're not able to take advantage of because you decide to go a different way. And that should be okay. You define success for yourself and don't let
Mm.
anybody else define it for you. So that would be my advice.
Oh, good stuff, man. Well, I appreciate you again, my brother, and definitely be in touch with you in the near future for some further episodes, and we can get together and make it happen for these folks.
Okay. I appreciate it. Thanks for the opportunity.
No problem, man. You take care of yourself.
Okay.
All right. Bye. You still on? Or you able to log out?
Oh, you want me to log out from here?
Yeah, you can log out.
Okay. Let's see.
All right. Later, bro.
Later.
All right, folks. That once again, that was James Frison, big man doing big things. If this conversation resonated with you, please share it, like it, or subscribe to our podcast whenever you get a chance. So once again, this is Marty Robinson reminding you that your health is your wealth. Your voice matters, and most of all, your work we do to uplift our community start with taking care of ourselves first. Until next time, stay unmuted.